Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right. Well, good morning and welcome to Insurance Matchmaking. I do have a guest this week, a little different from some of my other guests. I've had some of my veterans friends, some of my networking friends. But today I have Taylor Stevens from Physicians Mutual. It's the first carrier rep I've had on my show. He's the, I don't know if I say your title right. Are you broker manager, branch manager? What's your official title?
Yep. Good morning, everybody. And first off, thank you, Matt, for having me here. So my title is sales director.
Sales director, okay.
In the state of Tennessee.
All right. I knew it was, I was like talking him down. We need to let him toot his horn there. But if some of my listeners, I'm sure maybe you've heard me either on here or you've been to some of my Medicare 101 workshops, and you've heard me chant the mantra, a plan G is a plan G is a plan G. It doesn't matter if it's from Company A or Company B. They're all the same. And then I met Taylor. And now, and then let me kind of qualify it, and then I'll give him a shot at it here. Is Medicare has certain rules, and part of what I said is still true. There are certain aspects all plan Gs have to cover everything the same. They have to cover that all the same. But what Physicians Mutual has done is they've kind of expanded on that, I guess is a better way to put it. And I'm sure Taylor can explain it much better than I can. So a plan G is a plan G, but what is it that makes the innovative G different?
That's correct. And I'll start with this. As far as Physicians Mutual goes, we've been in business since 1902. So we've been in business for quite some time. And our focus has always
He hasn't been with them this whole time.
That is correct. But our focus ever since Medicare became a thing has been helping clients with Medicare. That's what we specialize in. That's what we focus on. And like Matt was saying, there are the basic minimum standards for Medicare supplements, where a plan G with one company is the same as a plan G with another. With that being said, certain states allow companies to add additional benefits and to change things up. So we've always taken that approach to be innovative. And in particular, we do have a plan that works a little bit differently than other carriers. It allows you to cost share with us essentially the first couple years in order to get the better coverage at a cheaper premium for the long term.
Right.
So everything that we do is going to be geared for the long-term coverage. That's one of the main benefits. And then there are also others. Some carriers will add in a gym membership. Some carriers will add in extra preventive benefits for anything that Medicare may or may not approve. So that's just a couple that I like to focus on.
So one of the things, and you also do a traditional high deductible G, correct?
That's correct. We do have the traditional high deductible G. And with that plan, I like to have clients focus on not necessarily the deductible itself, right? Because the deductible is $2,800. But keep in mind, Medicare is still the primary coverage. So whenever you go to the physician, Medicare is going to pay for and do what they do no matter what the supplement does. So in other words, that $2,800 really works more or less like a max out of pocket,
right?
Like you would have whenever you're on group insurance or individual coverage under age 65.
Yeah, and actually that was one of the things that you and I actually talked about yesterday. Is I have traditionally you go on Medicare when you turn 65. That's the majority of the people who go on Medicare. That's who they are, but there are certain cases. One of those being like kidney failure, kidney transplant. At any age, you can go on Medicare with that. And then you have people who aren't able to work anymore. They've gone on disability, and they're on what you call Social Security disability. Once they've had that for 24 months, they are now eligible for Medicare. Don't have to be 65. The downside of that in the state of Tennessee and in most states, some states don't even cover, but if they do, they are allowed to charge a much higher premium for their Medicare supplement versus someone who's 65. And I have a client that is running into that when we talk about, because one of the things I talk about in my workshops is, one, people think Medicare, I'm turning 65, I'm going to get my Medicare, it's free. That couldn't be further from the truth. But one of the things, too, is there is no maximum out-of-pocket protection with a Medicare supplement, with just original Medicare. So I have a client, disability is coming effective when they're age 64 and 11 months. So, and I'm recommending, hey, wait until you're, the next month to do your supplement, You're going to have your Part B premium anyway. You might have the hospital deductible, which is just $1,632. I usually just say $1,600. It's a little easier to remember. But you want to have something that protects you against that maximum out-of-pocket exposure, and sometimes that for people that is a Medicare Advantage. But like Taylor was saying, you've got those high deductibles on that high deductible G. Some people have a high deductible F if they were on Medicare prior to 2020. But it's well, they call it a high deductible, but it really is more like a max out-of-pocket.
That's correct.
Because once you hit that Part B premium, Medicare's paying their 80%.
Correct. And then client would have the 20% up to that, what I like to call max out-of-pocket, or that supplemental deductible. Now, keep in mind, if they do go into the hospital as an inpatient, they would incur Medicare Part A's deductible as well, the $1,600.
But that counts towards that $2,800, correct?
It does.
Yeah, that's what I'm saying. That's why it works more like a max out-of-pocket than a deductible.
Yep.
Because the only deductible you have with Medicare, unless you just have Medicare, but if you have a Plan G or a Plan N, Plan F doesn't have one. But people pay through the nose to have those Plan F. But kind of explain how. So we kind of explained the Plan G. I mean the high deductible G. Mm-hmm. We just kind of teased the innovative G.
Yep.
But the innovative G, you said in those first couple of years, works like the high deductible G, and then it becomes like the traditional Plan G. I guess is the easier way to say it. Can you kind of go into explain some of that for us?
That's correct. So the Innovative G is essentially a hybrid of both plans. So whenever you start out on the Innovative G, it's going to work exactly like the high deductible plan. So you'll have Part B's deductible, you'll have the 20% coinsurance, Part A's hospital deductible if necessary, up to that max or that plan deductible of $2,800. With the Innovative G, the unique feature about it is after 3 policy years, at that point in time, the plan transitions over into a traditional Plan G. And with the traditional Plan G, as long as Medicare approves the claim, the only thing the client's liable for is Part B's deductible of $240.
Right.
So essentially what that's doing is it's allowing clients to cost share with us initially during their healthier years. Most people are healthier whenever they're 65, 6, 7, and 8. In order to get the better coverage later on when they need it at a much more affordable premium for the long term.
Right. That's kind of the things. Now, in Tennessee, you do not have a Plan N because you have the Innovative G, correct?
That is correct.
And in the states, you don't have the Innovative G, you still offer a Plan N.
That is correct.
Okay.
Yep.
And the reason I bring that up, I've been actually encouraging a lot of people to consider the N instead of the G. It's kind of a few years ago, I was encouraging people to get a G and not the F because there's so much difference in premium. And because Taylor was alluding to on that, because with the Innovative G, because you are taking on that risk, that more cost sharing in those first couple of years, is down the road your premium is going to be lower. Because one of the downsides of a Medicare supplement is the prices do increase. As we get older, the insurance company wants more premium.
That is correct. And I think a lot of times, in insurance agents like Matt and myself out there in the field, we get kind of caught up with initially supplements being so affordable for the amount of coverage that they are. But we do forget that a lot of times whenever we talk to people who are turning 65, especially, the business owners, those who are on individual plans paying $1,000+ a month for their coverage, how much money we save them initially.
Yeah.
So that really does go a long way. And when it comes to original Medicare with the supplement, not worrying about premiums aside, there's really no better health insurance coverage out there.
Right.
With that combination, especially if you consider that traditional Plan G.
Yeah. And that's the one thing I always talk about. Medicare Advantage, yes, you can get a zero premium, but it's a pay-as-you-go. You know what your costs are with the Medicare supplement. You mentioned the third year. Now, depending on when you get if you do the Innovative G option, that 3 years, it's up to 3 years, I guess, because basically it's January of that third year is when it's going to go back to the traditional G.
That's correct.
So if you got it in March, you're going to get 2 years in 10 months, and then it goes to the traditional G.
A good way to think about it, it's the rest of the year you buy it plus 2 full years.
Yeah. Okay. That's probably an easier way to say it. Yep. And the thing is, but we talked about, you're starting at a lower premium because you're taking that risk. So when you do have those rate increases in the future, you're starting with a lower amount. Now, do you traditionally, because different companies traditionally, are your your rate increases across the board. Doesn't matter whether it's a G, Innovative G, Plan N, or F, wherever the case. If it's 5% increase, it's 5% increase on all your plans, or does it vary sometimes between the different letters?
Yeah, so traditionally it's going to be the same increase on all plans, and we do that in order to be fair to all of our clients, no matter what plan they're on, to keep things simple. But with that being said, if it's 5 or 6%, for example, like Matt just mentioned, 5% on a lower dollar amount is always going to be a lower dollar amount rate increase.
Right.
So lower dollar amount increases going forward with that Innovative G.
And if you think about it, as insurance agents, when we're talking whole life or something like that, we want to really bang on that compound interest. Well, unfortunately, that compound, I guess it's not really compound interest, but it's simple interest. But even so, that interest or that increase on a higher amount, well, the next year it's going to be on a higher amount again versus, so your overall, there should be a kind of a spread between, two 65-year-olds. One gets the Innovative G, one gets the traditional G. 10 years from now, there's probably going to be more gap between those two plans than what they were at 65. That's
correct, and that's because of how the rate increases work on the lower dollar amount. And one thing I'll say too, if you've been on Medicare, for a few years and you have a Medicare supplement clients can switch at any time throughout the year. We don't have to worry about time frames and the enrollment periods and whatnot. If you have Medicare Advantage, that's a little bit different. But from a supplement standpoint, as long as clients can qualify from a health standpoint, they can make any changes, necessary whenever that time comes, and their premiums have gotten a little higher than they probably should be, or than what can be affordable for the client. And that's where people like Matt come in. A local agent that you can go to, that you can trust, that's really going to put in the work to find the best coverage option for you.
Right. Okay. Well, we're coming up. Believe it or not, I told you, it goes faster than you think. We're actually coming up on that first break. But one of the things you mentioned about anytime during the year you can change your plan. When we come back, I'm going to have you address option of if you start out with the Innovative G and need to change mid-year or before that 3 years is up. So we'll cover that right after the break. But I just wanted to make sure that we kind of queued that up, tease it a little, as they say.
Perfect. Thank you.
All right.
What's your internet experience like? If you regularly lose your internet connection, consider Gig Speed Internet from Twin Lakes. Stream your favorite shows, play the latest games, and connect with friends and family without interruption. With Gig Speed starting at just $64.99 per month, there's never been a better time to switch. Experience the power of fiber with Twin Lakes. Call 800-644-8582 or visit twinlakes.net.
Do you have material left over from your last completed home project? Or have you redecorated and have good quality home decor pieces that need a new home? The Upper Cumberland Habitat for Humanity Restore needs your donations now. Do yourself and your community a huge service by clearing out that clutter and making sure it'll be put to good use by those in your community who need it most. Stop by our location today at 560 South Jefferson Avenue in Cookeville and make your donations today.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, well, welcome back to Insurance Matchmaking and here with my guest, Taylor Stevens, the State Sales Director for Physicians Mutual. And I teased a little bit there before the break. We talk about you can change your Medicare supplement plan anytime during the year, as long as you're healthy enough to change company, because a lot of times as those rates go up, sometimes, 5 or 6 years later, you find out, hey, you're paying a lot more than your neighbor. Well, maybe you should look at the plan they have. But if you've recently had cancer or heart attack or you're diabetic, you may not be able to change. There's something actually very unique on that. On the Innovative G, we talked about how, you got that extra cost sharing that, you could have that $2,800 out of pocket, but usually the thing is that you're never going to hit that out of pocket unless something happens like kidney failure, cancer treatments, things like that. What is one of those things there, too, how the Innovative G is different from other plans?
Yep. So back into, Physicians Mutual, and we like to be different. We like to be innovative. We add in what we call a 2-year selection guarantee on all of our plans, not even necessarily just the innovative. But what that allows clients to do is at any point within their first 2 years within Physicians Mutual, they can increase or decrease their coverage effective the first of that following month with no health questions whatsoever. So essentially, we're giving them 2 years to make their final decision. And what Matt was getting at there was if you do have the innovative plan and you have a surgery coming up or some type of procedure, your health may change. You can make that change to a traditional G at that point in time if you want to. That way, you avoid incurring that out-of-pocket cost.
And then it just goes to and then your commission. Typical agent. All I might ever think about is commission. The premium for that plan then would go to what is the traditional G
That is
rate
correct.
then.
That is correct. Yeah, if you leave the innovative G before that time frame is up, you would forfeit the discount, the lifetime discount that comes with it. But you would be able to have that option to get the better coverage quicker than you would have otherwise if needed. All
right, and you mentioned like some plans offer preventive benefits, some offer gym memberships. You didn't mention sometimes they'll do a little bit with dental. Typically, it's traditional Medicare, no routine dental, vision, or hearing. Most Medicare supplements, if they offer dental, it's usually just a dental discount. Some of them you can get a discount on a dental plan if you bundle them together. I'm sure you can explain it much better than I can. The preventive rider that goes with the G. With the G or the innovative G, either one.
Correct. Any plan. So that rider, it really adds 2 things to the plan. And the first thing it's going to add is we call it enhanced preventive benefits, enhanced preventive coverage. So when it comes to Medicare and Medicare's basic standard, they do a really good job of covering preventive work, but they do have frequencies in which you have to follow to get things done. And then some preventive services just aren't covered at all, with original Medicare. So just a couple examples. A physical exam, preventive annual physical exam, if you want to go and get that done, Medicare is not going to cover that, right? A mammogram, Medicare pays every 2 years. So if you want to go and get that done every year, at that point in time, you would have to come out of pocket every other year because Medicare would pay every other year. A colonoscopy is another big one. Medicare pays if it's preventive once every 10 years. Right? If it's diagnostic, that's different. But we're talking, preventive codes only. The bottom line is when it comes down to it, at the basic standard of what supplements are required to do, they follow what Medicare says. Right. So if Medicare approves a claim, the supplement has to pay for it. If Medicare denies a claim, the supplement's then left off the hook. And if you continue to get that done, at that point in time, the client would be responsible for it. Which they're going to come back and be mad at me because I didn't. I told them their supplement was going to cover everything, and it's like, not if Medicare doesn't cover first, it doesn't. That is correct. With the enhanced preventive benefit that Physicians Mutual allows you to purchase, it's an additional purchase on the plan. Essentially, what it does, anything that the doctor codes as preventive, if Medicare denies it, for example, that physical exam, Medicare would deny it. Physicians Mutual would see that denial and then pay it out at 100%. Right. And that is any preventive services. There's no max, there's no cap on it. We just want to make sure that you have the ability to go out and get the preventive test that you see fit for yourself. Now, I know you Physicians Mutual partner with someone who does those screenings. I don't know if we're able to say the name of the group that does that or not in this setting, but they usually set up like mobile, kind of like a mobile clinic. They'll take over an area. I know the Veterans Building that I'm on the board of trustees for the Putnam County Veterans Organization that houses all our veteran service organizations here. We all have our meetings there. That's a pretty good size hall, and so different organizations will rent it out every once in a while. I think it's getting rented out more lately and I know I'll say it wrong, but anyway. The Spanish thing when the girls turn 15. I'm not even going to try to say it. I don't know why I couldn't say the name of it right now. So that's where it gets rented. But this group had set up, and then, of course, we had that bad weather, so they're rescheduling. But, which is great for our building because we still have utilities and things like that. So we have veterans things that we get to do in there for, at no cost because it's owned by all the veterans. But this group would come in and rent it, but they set up their screenings, and people come in to do those, which I guess typically
you see that, you think, oh, these are free, and then they're not exactly free, but that preventive rider will actually cover those screenings.
Correct. Yeah, and those are screenings that really test quite a few different things. And then outside of that too, one other feature that we found out that clients can get done, thermography exams, something fairly new. Insurance typically doesn't cover a thermography exam, and basically what that is, it's a heat scan of the body. Okay. And it finds hot spots, areas of concern that you can then take the results back to your primary physician and do some further research for. So that is something that preventive benefit would kick in and pay for as well.
Actually, I wasn't even really familiar with that one. Is that kind of usually like a cancer indicator or like arthritis because of the inflamed joints, or is it both? Or?
All of the above.
Yeah.
All of the above. So we've heard of clients using it, for instead of a typical mammogram, doing it for breast cancer. And it typically finds those hot spots a lot sooner than other standard tests would.
Interesting.
And you still have to take those results back to your primary physician and do some further research for it. But it's a good way to at least know that there may be something going on.
Right.
That way your physician can do some further research on it.
Now the other thing on the lines of this preventive rider is you've seen all the TV commercials. I like to say, don't call Joe, but they advertise the dental, vision, the over-the-counter benefits. They talk about the gym memberships because typically most Medicare supplement plans aren't going to have a gym membership on them. And even Physicians Mutual, if you just get the plan, there's no gym membership. And so the different Medicare Advantage, they have Silver and Fit, Silver Sneakers, Renew Active. I'm trying to think. Seems like there's one other one out there, but Silver Sneakers is the one most people know. It's been around forever, and it was like every company out there that offered. It seemed like every company out there that offered Medicare Advantage added Silver Sneakers to their plan. Free gym membership. You can do home stuff. They'll send you equipment for you to be able to work out at home, and pretty much all these plans do that. But unfortunately, it's just been in the last few years that Silver Sneakers doesn't work at the YMCA. And we're here. We're on a Cookeville radio station. We have a great YMCA right here in Cookeville. But if you have a plan that has Silver Sneakers, you're out of luck, or you can pay for a regular YMCA membership. Tell us a little bit more on that not the innovative rider, but the preventive rider.
That's correct. So the second thing that preventive rider adds on, and it's one rider for both, is access to the Silver and Fit program. So not like Silver Sneakers, like Matt was saying, we have access to Silver and Fit. And one of the unique benefits about Silver and Fit is, at least in the state of Tennessee here, the YMCAs are included.
Right.
So if you have the supplement, if you have that rider, you can apply for the YMCA gym membership through that program and have free access to that program. There are other programs out there, other gym programs that you can sign up for with that. That's just a big example that a lot of clients look for. And then there are also premium facilities that clients can go to for a discounted rate.
Now, and all those benefits you've got there, that must cost about $20 or $30 a month to add on to your plan, right?
Not at all. It's less than $10 a month.
So
it's very affordable, and if you use it, you'll get your money's worth out of it.
Yep. I have a bad habit. I always like to round things off and say, hey, who wouldn't like a YMCA membership for $10 a month? So if you're interested in, if you're looking at a Medicare supplement and that gym membership is really kind of a big factor for you, adding I say adding $10. Let's keep it round numbers, but it is less than $10. Even if you didn't think you'd use those preventive benefits, but again, typical cost of a physical, if you're paying for it,
about $200 on average.
And so $10 a month. Let's see, there's 12 months in the year. That's $120. So you're still getting it physical for half price if you did nothing else with that preventive rider. So it's a good add-on. And I know it's hard when we're sitting there with a client and we say, hey, you really need to consider this. It's like, oh, there we go. Would you like fries with that? We always got to add on. There's always the upsell, the cross-sell, but I really like this benefit. It's one of the reasons why I decided to get involved with Physicians Mutual. There's a lot of competition out there. There's so many companies to work with. I don't work with them all. It's too many to try to keep up with. And that was one of the things I hesitated when I first met Taylor, that, yeah, you've some interesting things. I just got so many plans I'm working with. I don't want to confuse myself. But, talking with them some more, listening to, some webinars and things like that and go, yeah, there's really good benefits to this. And that's why I said, hey, that's why I wanted to get him on my show, because he could explain some of these things better. And I got to, if I'm saying it wrong, he can correct me. So wanted to have him on that. And we're actually getting close to the end of our half hour here, and I think we're not done. So probably what I'm going to do is we'll wrap up this show, and then we'll start, and then we'll go ahead and record for another week. Obviously, when we talk about it again later, or when you hear the second show, it'll seem like it'll be a week difference for you, but we'll go back. It's kind of funny. I've done that a couple times, but as I say, we're coming up on towards the end of this show, so I wanted to get that in. I'm probably cutting my own foot off here, but if somebody wants to know more about Physicians Mutual and they don't want to talk to me, what's the best way for them to get a hold of you?
Yeah, so best way for me is really in my direct line, one of my cell phones that I have on me all the time. It's 629-257-3585. Call me there anytime if you want to send me an email, taylor.stevens@physiciansmutual.com. Stevens with a V-E, not a P-H.
Yeah. And we always talk, I had to call him yesterday, and I'm trying to remember, which one's the cell number? Because, officer, but it always throws me, and maybe you were aware of this before me, but 629 is a Tennessee area code. We're used to 615 being Nashville, but Nashville grew a little bit more, needed another area code. And most of us can remember when most of Tennessee was 615, or if you're my age, you can.
That is correct. That is correct.
So they keep adding our area codes in. I just heard on the radio the other day there's another area code in L.A. because there's just and some of it is these robocaller people keep buying up all these phone numbers. That's why they're running out of phone numbers. If they crack down a little bit on that, they probably have enough numbers for everybody and not need a new area code. All right, I'll get off my soapbox there. But like I said, we're going to break here and then come back in and do a second show because there's some other things that I wanted Taylor to share with you. And so I'm sure we won't have any trouble filling the time for another show. But the other thing I want to mention, insurancematchmaking.com. That's my website for the show. As always, there's a box there that you can go ahead and fill in your questions maybe that you have that you'd like me to address on the show. I've also suggested, hey, if you know somebody you think would be a good guest, recommend them. They don't have to be in insurance. They could just be a nonprofit that wants a little more exposure. And as I've said before, especially if they do something in the veterans community, being a 20-year Army veteran myself, I have a soft spot for people who do things for veterans. So I like to give them time on my show. So with that, we will break from this show, and then we'll restart here on our end, and you'll hear it as a new show.
Yeah, thank you, Matt.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.